Hello, my name's Adam Sharp, and I'm an emergency physician in Los Angeles and part of the Kaiser Permanente Southern California medical group. Emergency medicine is filled with resilient and tough-skinned individuals. But early in this pandemic, when it was clear that we were outmatched by this new and deadly virus, I saw and witnessed the heroism and compassion that is intended to be the bedrock of medicine. I saw individuals work tirelessly and in many cases at their own potential peril, willing to help others and anyone in the community who needed it. And that is what we're supposed to be about as physicians, as healthcare leaders, and other healthcare personnel. Unfortunately, I have also seen far too many worsenings of our systematic inequities and healthcare system failures. I want to tell you a little bit about one of the first patients I saw in the emergency department I suspected of COVID-19. He was an African-American man who came in short of breath as we were seeing an influx of COVID-19 patients that I suspected of this new virus. I was donning my PPE. I could see him laboring to breathe as I looked through the glass door. But it became clear soon that this was not the virus, this was a system failure. This man incredulously told me he was there and it was his fault. He said that he had been unable to continue with his health insurance because he couldn't afford the premiums that were being raised at his annual increase through his employer. And without insurance, he couldn't see his physician, and without his physician, he could not get the medications that he required in order to maintain the health that he benefited from. Therefore, after his medications ran out, his legs swole, and he couldn't breathe, bringing him to my emergency department, hypoxic and in extremis. Another example, which should have been heralded as an overwhelming medical success, an elderly woman of color who was disadvantaged financially had survived her prolonged hospital stay with COVID-19. She'd gotten through her hospital stay and an intensive care unit stay and had been discharged home. Unfortunately, she came back to my emergency department and I saw her 2 days after her hospital discharge. The ambulance brought her because her outpatient dialysis had not appropriately been coordinated and rescheduled after leaving the hospital. And the transportation that usually took her to her dialysis appointments was not available and not scheduled appropriately. So her trust in our system to help facilitate the care that she required in order to breathe and live healthy had failed her. And thus her trust was gone in our system's ability to provide for her what she needed. Despite these inequitable systematic failures, I want to end with a story that should give us hope. Not hope in the miracles of modern medicine, but a hope in humanity and the compassion that can exist there. This story is sadly about a woman who died from COVID-19. Her name was Carol Ann Lambert. She was a white woman. She was well educated. She had adequate insurance. She had social stability, she had transportation to her hospital appointments, and she lived in a comfortable home. Her story is similar to many that we have heard recently. She had a dry cough, and over the course of a week, she progressed from a very independent and vibrant elderly woman to dying from acute respiratory distress. I'm the oldest grandchild of Carol Ann Lambert, and I will be forever indebted to the physicians and the nurses that took care of her. Indebted because they broke some of the rules of the system in order to provide compassionate care. When there was a no visitor rule due to COVID-19, they allowed my mother to go in and visit my grandmother to say goodbye. They gave of some of their limited PPE for her to be there safely. And my mother was able to hold her hand and broadcast via video conference to myself and our large family so we could say goodbye, so we could tell her that we loved her before she left us in this earthly state. Now, I hope we can build a system that can be as compassionate and as caring to people whose skin complexion may be different from mine or my grandmother's, or whose social circumstances may not be as fortunate. And when we build a system that can provide health care equitably to those who need it and at the time when they need it, then we will have a system that's trustworthy. And then we will have succeeded. And I look forward to building that system with each of you.